So in today's video, I want to talk about the impact of weight loss injections on the gallbladder and gallbladder health in general. So we know that weight loss injections, Wegovy, Mounjaro, are increasing the risk of gallbladder removal. And I fully acknowledge that some of that risk comes from rapid weight loss, and that if you lose weight rapidly and you're not on weight loss injections, then there is a risk of losing your gallbladder. And I certainly don't want to be scaremongering. I have no axe to grind with people that use weight loss injections, but we are seeing an impact on the gallbladder with weight loss injections. And the purpose of this video is to just raise awareness and to give you some simple tricks and tips to help support you so that you can hopefully have a good weight loss injection journey. So of course, we know that weight loss injections cause the gallbladder to keep bile in there longer. So the gallbladder is a small, tiny organ connected to the liver, which is responsible for the storage and secretion of bile. So as we're eating food and food leaves the stomach to enter the intestines, the gallbladder should contract to release that bile, which then gets mixed in with the stomach contents, the contents that have left the stomach, to break down and emulsify those fats so that the body can absorb and use them. When you use weight loss injections, they prevent the contraction of the gallbladder and the release of bile. And that then means that the bile stays in the gallbladder for a lot longer. When bile stays in the gallbladder longer than it should, there's an increased risk that it becomes too concentrated with cholesterol, and then it can become sludgy. Once it's become sludgy, it can then be mixed with calcium and calcify and cause gallstones. So there is an increased risk of gallstone production with weight loss injections because the gallbladder isn't moving the bile through effectively. So it isn't just about the weight loss injections. So there are some patients that are more at risk of this. So females are more at risk of gallbladder issues than males. And that's primarily because we have much higher levels of estrogen, the sex hormone. And estrogen is involved in the regulation of gallbladder function. And it's also involved in the production of cholesterol. So sometimes you'll find that as you hit menopause, for example, the risk of gallbladder sludge and gallbladder disease goes up because of the changes during the perimenopausal phase. People that are diabetic, people whose blood sugar isn't well balanced, so if you're eating too many carbohydrates and not enough proteins and fats, that increases your risk of gallbladder sludge. If you have a thyroid disorders affect cholesterol production, which again increases the risk of gallbladder sludge. Certain antibiotics can increase the risk of gallbladder sludge, and things like metformin used for diabetes also increases the risk of gallbladder sludge. So if you fit into that category, then it's important that you're much more vigilant for signs that your gallbladder needs some support. Men are not immune to this. Males can also have gallbladder issues. It's just less common, but it is something for you to watch out for. So what symptoms can we see? So the key symptoms of gallbladder disorders include pale, floaty, greasy bowel movements, diarrhea or urgent bowel movements, particularly late evening, overnight, early morning. We also can see reflux, quite severe reflux rather than the sort of typical reflux, but particularly reflux that doesn't respond to PPIs is quite a key sign that there's an issue. That can often be combined with trapped wind or excessive burping. Some people actually describe it almost like a heart attack. One of the other signs that you can get is left-sided shoulder pain, which is why often people think that it might be an issue with their heart. And that's because of the nerve pathways that go from the abdomen to the shoulder. so that when the gallbladder is inflamed and pressing on the diaphragm, we then get issues with referred pain. Oftentimes it can feel like there's a tight band around the chest, and you can also just have back pain around the lower rib area. So those are sort of key signs that there's an issue with your gallbladder. You don't have to have all of them. You can just have a couple. You can just have the diarrhea. You can just have the excessive burping. It varies from person to person. But if you've got several risk factors, if you've lost quite a bit of weight, if you're using the weight loss injections and you've got those even just 1 or 2 symptoms, it's a really good idea to ask the GP to run some tests. So the GP will start by testing your cholesterol levels and your liver function. If they come back elevated, then often the next step will be to have an ultrasound of your liver and your gallbladder, where they can actually look to see if there's any sludge or if there are any gallstones there within them, and then we can manage it from there. From a management perspective, for yourself, then using things like some lecithin powder. So you can buy sunflower or soy lecithin powder, and what that does is it helps to break the bonds between the bile and the cholesterol. So it helps to reduce the thickness of the bile, reduce the sludge, and that will enable it to start moving through the gallbladder a little bit easier. So I usually recommend to get a powder, because that's classed as a food and it's really easy to incorporate into your diet. It doesn't matter whether it's sunflower or soy. And what I usually recommend is to use a 1/4 teaspoon initially in the morning. So you can sprinkle it on your breakfast, you can mix it in a smoothie, you can mix it with water. And you need to keep at that dose for a good 4 or 5 days, see how your symptoms respond, make sure that you're not getting more constipated. And then if your symptoms haven't gone and you're feeling okay, you can then increase it by a further 1/4 teaspoon. And you want to do that every 4 or 5 days until you get to the point where your symptoms are much greater improved. You also need to make sure that you're eating a varied diet, that you're balancing your protein, fats and carbohydrates so that your blood sugar is under better control. If you have got a thyroid condition, making sure that your thyroid hormone function is really good is appropriate too. And you need to think about the fat intake in your diet. So you don't want high levels of fat, you don't want processed unhealthy fats, but you do need a small amount of healthy natural fats, which just help to keep the body needing to move some bile through. So that includes things like olive oil, small amounts of avocados, oily fish. All of those things can just help to keep the bile moving through. So my key takeaway is obviously think about the foods that you're eating. Add some lecithin to your food if you've got some symptoms of gallbladder issues. If that doesn't help, get the GP to double check that you've not got a gallbladder full of gallstones. And if you're still struggling and you want some support, then feel free to check out my reflux practitioners who are all trained to manage gallbladder disorders. You'll find them on my website, Digestion with Confidence. We'll pop that into the comments. You'll also find it in my bio. And you can always pop some questions into the comments and I'll answer them when I can as well. I hope you've enjoyed this video. Please do make sure to give it a like and subscribe so that you get updated with future videos. And if you're somebody that's getting reflux with weight loss injections, then make sure you check out my reflux video too. Thank you.